Welcome everyone. Today our presentations focus on one of the Glasgow most pressuring social concern, homelessness. This issue affects thousands of individuals and families across the city and continues to challenge local authorities, charities and communities. Our work today connects the real-time problems with leadership theory by examining how effective leadership can influence positive social changes. We focus particularly on the leadership of Lorraine Amsgate, the CEO of Simon Community Scotland, who has played a transformational role in saving homelessness response in Scotland. These presentations will explore the scale and cause of homelessness in Glasgow, analyze current leadership approach and limitations, and demonstrate how transpersonal relationship can be applied to produce meaningful improvement. By the end of the presentation, our aim is to show how not only the importance of leadership theory is in practice, but also how leadership can drive sustainable, comprehensive solution that benefits society as a whole.
All right, introduction to the issue. Homelessness includes far more than rough sleeping. It affects people in temporary accommodation, hostels, or unstable and safe homes. Glasgow shows some of the Scotland's highest homelessness figures, with pressure made worse by rising living cost and past post-pandemic challenges. Sorry, this issues matters because it's affect dignity, well-being, and public health, and ultimately impacts the resilience of the whole community. Understanding the depth of issues helps explain why strong leadership is essential.
Recent data shows the seriousness of the situation in 2023. Scotland recorded over 32,000 homelessness applications, and Glasgow represent a significant share. Presentation have increased since COVID-19 due to economic instability. Rough sleeping remains highly visible, especially in the city center. Group includes young people, refugee people with a mental health condition, and individuals facing addictions. Many experience multiple disadvantages, making stability difficult. The static shows that any leadership solution must be grounded in evidence and community needed.
Homelessness stems from a mix of structural and personal factors. Poverty, unemployment, and rising housing costs push people into unstable accommodation. Glasgow also faces a shortage of affordable housing. Mental health challenges, trauma, and substance misuse commonly overlap with the homelessness. Family breakdown, domestic abuse, and relationship conflict also contribute. Because support services are inconsistent, many people move repeatedly between temporary accommodation and the street. Effective leadership must target these deep root causes, not just the short term symptoms.
The current approach to homelessness in Glasgow is predominantly bureaucratic and transactional. Local authorities follow rigid procedure based on legal requirements, assessments, and eligibility criteria. While these processes ensure transparency, they often slow down service delivery and create gaps in care. In practice, agencies such as housing, health services, and social support often operate independently, leading to fragmented support. For example, an individual may receive temporary housing but lack access to mental health services or addiction recovery support. This lack of integration limits the effectiveness of homelessness intervention. The transactional nature of the system focus on short-term outputs rather than long-term solution fails to address complex needs. As a result, many individuals continue to cycle through temporary accommodation without achieving permanent stability. A stronger, more visionary leadership approach is required.
Chosen leader, Lauren Magritte. Lauren Magritte is one of the Scotland's most influential leaders in homelessness services. She is the chief executive officers of Simon Community Scotland, the largest homelessness charity in Scotland. Within more than 25 years of experience in community services, She has been central in shaping Glasgow's homelessness responses. Margaret advocates for uh, person-centered supports, dignity, and long-term solutions. Her leadership has played a vital role in implementing uh, housing first in Glasgow, a model that provides stable housing before tackling mental health, addictions, or employment issues. She demonstrates key leadership quality includes comparison, collaboration, advocacy, and innovations. Margaret's approach aligns strongly with transformational leaderships, making her an ideal leader for this analysis. Uh, Her work directly responds to frontline challenges with strengthened practical relevance for this presentation.
Transformational leadership is a theory focused on inspiring and motivating teams to achieve meaningful changes. Transformational leaders communicate a strong vision, empower their followers, and encourage innovation. The approach is holistic, embracing long-term transformations rather than short-term results. In the context of homelessness, transformational leadership is a particular values able because the issues require coordinations between multiple agencies, creative problem solving and strong values. Leaders using these styles helps build trust and engagement, especially among vulnerable populations who may feel excluded from traditional systems. Transformational leaderships also support a culture of empathy, sheer responsibility, and continuous empowerment all over the essentials when addressing complex community issues. Laurent McGrath demonstrated the principles through the vision, her advocacy from systematic changes, and her commitment to empowering staff and service users.
McGrath's leadership is visible in several practical ways. She has been central to the success of Housing First, shifting services from crisis management to long term stability. She promotes strong collaboration involving the NHS, Police Scotland, Glasgow City Council, and third sector organisations. She supports flexible outreach, trauma informed practice, and mobile support teams. By empowering staff and valuing frontline insight, she encouraged innovation and ownership. These approaches have been improved engagement, trust, and services outcomes across the Glasgow. Our proposed solution builds on the philosophy and integrated transformational outreach model. It combines rapid rehousing with intense multi agency support, including mobile mental health counseling, addiction recovery vans, and joint street teams involving housing, health, and social care. The module centers on personalized immediate support and also includes peer mentors with lived experience. Its strength lies in targeting root causes while promoting long term stability. It aligns fully with the transformational leadership principle, though it does require committed funding and policy backing.
If implemented effectively, this model can deliver major benefits: rapid rehousing, reduce rough sleeping, and improve safety. Integrated teams prevent gap in support. Early intervention through mobile mental health and addiction service reduce harm and supports recovery. Community involvement decreases stigma and builds social cohesion. And by gaining stable housing, people are more likely to access education, employment, and healthier lifestyles. The wider community benefits from reduced energy service use and improved well-being overall. To conclude, homelessness in Glasgow remains a serious challenge. Bureaucratic and fragmented leadership approaches have not addressed the core causes of homelessness. Lawrence Magret shows how transformational leadership can offer a way forward grounded in vision, collaboration, and empowerment. Our proposed model extends these principles by combining rapid rehousing with holistic, integrated support. Strong leadership can drive sustainable, compassionate solutions that improve lives and strengthen communities. This presentation demonstrates how leadership theory can guide real, impactful social change.